Hello and welcome to today's webinar about camp preparedness for pediatric primary care teams provided through a collaboration between the Pennsylvania Medical Home Initiative, a program of the Pennsylvania chapter of the American Academy of Pediatrics, and funded by the Pennsylvania Department of Health. This webinar, led by Dr. Kelly Curtin-Hallahan, Dr. Jennifer Franceschi, Hosterman, and Dr. Renee Turchi, aims to recognize ways to manage simple oral health problems at camp and how to provide effective anticipatory guidance to patients and caregivers, identify ways to empower the patient and caregiver to make healthy nutritional choices, and to recognize common nutritional pitfalls at camp, and discuss the unique role of care integration for children during and post-COVID-19. I am Eileen Thompson, the Program Director of the Pennsylvania Medical Home Initiative at the Pennsylvania chapter of the American Academy of Pediatrics. This webinar is being recorded and will be available upon request. Please be advised that Dr. Franceschi and Dr. Turchi do not have any disclosures. Dr. Curtin is a consultant camp physician for Camp Lahican in Lake Como, Pennsylvania. Please note that the information presented in this webinar is educational in nature and does not necessarily represent the views or policies of the Pennsylvania chapter of the American Academy of Pediatrics or the funders. It is now my pleasure to introduce our presenters for today's webinar. Dr. Kelly Curtin is a general pediatrician for WellSpan Health and a consultant medical director for the Pennsylvania Office of Medical Assistance. She is a chapter oral health advocate and presenter for Healthy Teeth, Healthy Children, a program of the Pennsylvania chapter of the American Academy of Pediatrics. Dr. Curtin is a staff physician at Camp Lahican at the Poconos. She serves on multiple committees for the American Academy of Pediatrics, WellSpan Health, and her community in central Pennsylvania. Also presenting today is Dr. Jennifer Hosterman. Dr. Hosterman is an internal medicine and pediatric physician who is boarded in obesity medicine and nutrition support. She is the director of pediatric weight management at Geisinger Medical Center in Danville, Pennsylvania. She also is the medical director for a health and wellness camp for adolescents called Camp Energy that is held in Millville, Pennsylvania at Camp Victory for the past 8 years. Today, she will be talking to us on how to provide effective anticipatory guidance to patients and caregivers regarding nutrition and health during camp. And also we have Dr. Renee Turchi, who is Section Chief, General Pediatrics and Medical Director of the Center for Children and Youth with Special Health Care Needs at St. Christopher's Hospital for Children in Philadelphia. She is Medical Director of the Pennsylvania Medical Home Program at the Pennsylvania chapter of the American Academy of Pediatrics, a statewide quality improvement program for pediatric practices across Pennsylvania, funded by the Pennsylvania Department of Health and the Maternal Child Health Bureau. Dr. Turchi is a professor of pediatrics at Drexel University School of Public Health and College of Medicine. Her research and clinical work around care coordination and children and youth with special health care needs have been presented and published in multiple national forums. We are so delighted to have Dr. Curtin, Dr. Hosterman, and Dr. Turchi present for us today. At this time, we will begin our presentation. Dr. Curtin, you can start us off. Thank you.
Thanks, Eileen. So I'm Kelly Curtin-Hallahan. I'm a pediatrician for WellSpan Health in New York, and I've been asked today to discuss camp preparation from an oral health perspective. I'd like to recognize my contributors from the Pennsylvania Oral Health Collective Impact Initiative. I'm also a presenter for Healthy Teeth, Healthy Children, and many slides from this presentation are from Healthy Teeth, Healthy Children's Oral Health in Your Office presentation. Special thanks to Kristen Higeli-Hill and Dr. Kimball at Healthy Teeth, Healthy Children, and Helen Hockey from the Pennsylvania Coalition for Oral Health. I do have one disclosure that I am a paid physician for a co-ed overnight camp, Camp Lahican in the Poconos. I worked there last summer, and I have plans to return this summer, but we're waiting for further directive at this point in time. So for the purposes of this talk, camp includes all types of camp, day camp, overnight camp, sports, special needs. So today's learning objectives are Recognize the impact of oral health on the overall health of children. Explain the etiology of early childhood caries. Provide effective oral health anticipatory guidance to patients and caregivers for both home and camp. And prepare to recognize and manage common oral health problems at camp. So why pediatricians? Why do we care about the teeth? Why not just leave it to the dentist? It's because we're the ones seeing patients, and it's part of their overall health picture. Children see medical providers 10 times by age 2 for checkups, and at least annually after that. Ideally, we get all children to the dentist by 1, but pediatricians have an opportunity to capture patients in our office, provide treatment, provide anticipatory guidance, give fluoride, screen for cavities, and refer. Like myself, a lot of providers have not had much training in medical school or residency in oral health. Parents often ask why baby teeth even matter since they'll fall out. So some things to consider. Primary teeth are important. Primary teeth hold places for permanent teeth, contribute to speech development, and are necessary for chewing and proper nutrition. Typically, the last baby tooth is not lost until a child is between the ages of 12 and 13. Oral health influences overall health. Poor oral health can cause intraoral abscesses, facial cellulitis, diabetes exacerbations, poor pregnancy outcomes, even death. Prevention works. It's easier to prevent than treat a problem. Dental infections are a significant source of pain and absenteeism in children, and studies show interventions like fluoride treatments can decrease the rate of developing caries by 30 to 60%. Preventive medicine is cost-effective health care. It's cheaper to prevent than treat a problem. The PCP is already looking in the mouth. It takes a minute to provide education, which can be done while talking with the parent. And of course, it supports our concept of medical home. So what causes dental caries? Caries development is a multi-step process that results in destruction of tooth structure. Oral bacteria metabolize dietary sugars into acid. The acid demineralizes the tooth. And if this cycle of acid production and demineralization continues, the enamel weakens and breaks down into a cavity. Caries or cavities are not only the most common oral health illness in children, they're the most common illness of childhood overall. As a point of reference, caries are 5 times more common than asthma. Their progression is preventable with education and treatment. This is why preventing caries through risk reduction and early treatment should be a major part of your oral health anticipatory guidance. So anticipatory guidance for your camp physical varies minimally from our typical oral health guidance. You should focus on referring to the dentist, discussing fluoride, discussing food choices, reviewing hygiene, and then reviewing any special problems with orthodontics or with any children with special health care needs. We want all children to have regular dental care. You should confirm the patient has a dental home and regular care. Remind them to discuss the plan for emergencies with their dentist while they're away from home. Depending on the location of camp, or if it's a sleepaway camp, they may need to identify a local dentist to the camp. In some situations, you may need to make a more urgent referral during your camp physical. Make sure the child has a dental appointment within 2 to 4 weeks if there are white spots or tooth decay is observed, if the child is at moderate or high risk for early childhood caries. And call your dentist immediately if you see brown spots or advanced progression of earlyhood child caries, or any kind of dental trauma or emergency is evident on your exam. At camp, a child may be responsible for their own oral hygiene. Recommend packing an oral care kit, including a toothbrush, toothpaste, floss, and mouthwash. This might seem obvious, but review with the patient how to brush their teeth. They will need 2 minutes, 2 times per day. Use a pea-sized dab of fluoridated toothpaste. Make sure they move the brush back and forth gently in short strokes. Teach them to brush the front, back, and top of the teeth. Teach them to brush their tongue to remove germs and freshen breath. And then teach them to spit the toothpaste out when they're done. And just because a parent packs a toothbrush doesn't mean their child will use it. Some ideas for making compliance more likely, perhaps leaving reminders in their bag. On the website www.2minutes2times.org that's listed here, you can download a 2-minute video for them to watch while brushing their teeth, or send an incentive chart like this with a predetermined reward for compliance with their oral hygiene while away. A lot of patients have emotional feelings about fluoride, but reinforce the importance of fluoride in keeping their kids' teeth healthy. Fluoride is a naturally occurring mineral found in soil, water, and foods. There are two basic types, topical fluoride. This is the fluoride in toothpaste, rinses, professionally applied gels, foams, sealants, and varnish. Topical fluoride inhibits tooth demineralization, enhances remineralization, and may arrest or reverse early caries. It inhibits bacterial metabolism, is not a risk factor for fluorosis. Systemic fluoride, such as the fluoride in water or prescribed supplements, strengthen the enamel during tooth development. Excessive amounts can produce tooth staining, such as fluorosis. And this is just a reminder that both topical and systemic fluoride have a Category B recommendation from the United States Preventive Task Force. The fluoride supplementation recommendation is for children whose water supply is deficient in fluoride. Each provider should base use of fluoride supplementation on risk factors, water fluoridation, caregiver oral health assessment, or other factors. And if it's available in your office, dental varnish can be applied at a pre-camp visit. Nutritional choices are going to be discussed in detail more later, but this is one thing that my kids most look forward to, picking their own snacks and foods with little oversight. Make sure when you're counseling them you emphasize water, limit snacking, healthy food choices. Remember that bacteria metabolize sugar into acid, which destroys enamel. The frequency of the sugar ingestion is more important than the quantity for caries development. I've included this photo of two of my children at their camp cafeteria. Note the fountain beverage behind them, which has free-flowing soda, juice, sports drinks, and remind them that water is always their best choice. Your time is important, and this is an opportunity for combined counseling. Oral health counseling can be combined with obesity prevention since the risk factors are essentially the same. The most common oral health issue I've experienced at camp is problems with braces. Dental hygiene is still the most important thing they can do for their braces. Encourage your patients to discuss an emergency plan with their orthodontist and have a pre-camp appointment. Make sure they bring a braces camp kit with extra toothpaste, extra toothbrushes and wax in case a wire breaks. Make sure the patient knows if anything were to happen to their braces, they need to inform their counselors. And just like eating habits at home, the same instructions apply while away at camp. Avoid sticky, chewy, or hard foods. Remember that mouth guards are recommended if participating in contact sports. Dr. Turchi is going to also be discussing this in more detail, but many children with special healthcare needs may attend camp with their peers, or there be many special camps specific to children with their specific needs. These children may already be at higher risk for oral health problems for a variety of reasons, including physical limitations, behavioral influences, and medication effects. The treatment, though, is essentially the same. Your job in the medical home is to identify their needs while giving the same message, confirm a dental home, refer if needed, discuss hygiene and fluoride. These next few slides are geared to physicians working at a camp who may not be accustomed to dealing with oral health or dental problems in our regular jobs. Primary prevention is essential at camp. Make sure safety equipment is appropriate for activities available. Encourage mouth guards, limit high-risk activities. We know what activities are more likely to lead to injuries. At my camp, the most injuries are always on capture the flag night. Review supplies that might be available at camp in advance, such as gauze, wax, wire cutters, milk or a save-a-tooth solution, antibiotics if that's appropriate for your camp, and NSAIDs for pain. Familiarize yourself with local dentists or emergency resources. Know which ERs or urgent cares are comfortable with pediatric dental problems. Trauma is common in the pediatric population. It's important in determining the course of treatment for a dental injury to be able to describe it. This is a pictorial list for reference of other injuries from the International Association of Dental Traumatology. If you need to review injuries types to communicate with a dental colleague, there are tables available, these exact tables, at www.dentaltraumaguide.org. Avulsion is the most common type of injury, but the treatment is very different depending if the avulsed tooth is a primary or a permanent tooth. These are the guidelines from the American Academy of Pediatric Dentistry. If a primary tooth is lost, contact your pediatric dentist Rinse the mouth with water and apply cold compresses to reduce swelling. Your focus should be comforting the child rather than looking for the tooth. Primary teeth should not be reimplanted because of the potential damage to the permanent tooth. However, if a permanent tooth is lost, find the tooth, rinse it very gently with cool water, do not scrub it, do not use soap. Replace the tooth in the socket and hold it there with a clean gauze or washcloth. You cannot put the tooth back in the socket. Place the tooth in a clean container, preferably with cold milk or a Save-A-Tooth solution. These are not available. Use a container with the child's saliva, but do not put it in water. And take the child and the tooth to your pediatric dentist immediately. If a tooth is chipped or broken, contact your dentist. Rinse the mouth with water and apply cold compresses to reduce swelling. And if you can find the broken fragment, it's important to take it with you with the patient to the dentist. Besides avulsions or fractures, there are some other dental reasons for emergency consultation. An extrusion of more than 3 millimeters or one that interferes with bite, laterally luxated teeth that interfere with bite, intruded primary teeth, and if you're not sure what these are, you can refer back to the descriptive chart a few slides back. If you suspect a jaw fracture because of posterior tooth fracture with jaw tenderness and malocclusion, or any kind of injury that the child may have suffered that you suspect might involve embedded tooth fragments. After any dental injury, good oral hygiene is absolutely necessary and the area needs to be monitored. After the teeth resettle, it's important to watch for signs of abscess. These can occur from the teeth resettling up to 6 months after a trauma. It's important to give instructions to wash the area, wash the tooth, and see if redness occurs in the gum over the tooth. If this occurs while the child's still at camp, see the child, prescribe antibiotics, and refer to the dentist. When the kids go home, remind the parents to flip the lip when they're looking at the area and not just looking at the tooth. Soft tissue lacerations are also common, and most do not need repair. You want to evaluate for airway compromise or hemorrhage, and refer if wounds are deep enough to trap food particles, wounds are greater than 2 centimeters in length, wounds with a flap of tissue between the chewing surfaces of the teeth. You can consider prophylactic antibiotics like amoxicillin or Keflex if the wound itself is gaping, and be sure that you know the patient's tetanus status. So in conclusion, oral health is an important part of medical home. As pediatricians, we have special ability to reinforce oral health messages to our patients, and camp can be a formative time for many children, giving them a chance to practice new skills and habits. With your help, they have an opportunity to practice lifelong healthy habits. These are just some references if you're interested, provided to me by Healthy Teeth, Healthy Children. And I'd be happy to answer any questions at the end of the presentation. Thank you.
Hi, everyone. This is Dr. Hosterman. As Eileen pointed out, I am one of the weight management physicians at Geisinger, and I'm also the camp medical director for Camp Energy, which is a health and wellness camp over here in Millville. Today, we'll be talking about a couple of things. My goal by the end of my portion of the discussion is to enhance knowledge and be able to effectively provide anticipatory guidance regarding nutritional choices and just health and wellness at camp, empowering the child, not only the child and camper, but also the parents. And to do that, we'll go through some of the common nutrition pitfalls, or medical pitfalls that can happen at camp. We'll review some of the nutrition choices and some strategies, some practical strategies at camp. And like I said, it really empower the patient or caregiver and camper to utilize camp as we want it to be, a positive experience, a healthy experience. So when I think of camp, I think of all of these things. I think of going swimming. I think of a color run. I think of rock wall climbing. I think of team building. I think of kids outside, happy, having a great time. At Camp Energy, we started about 8 or 9 years ago. We started as a weekend camp. And a couple years ago, we were given the opportunity to extend camp into a week-long camp. There was an opening, and we were grateful, and we were very excited. I was very excited to be able to promote health and wellness to the campers, and I was thinking of all these great activities we could do with them, all these wonderful things. And then Wednesday came. Wednesday came, and Wednesday is Pie Lady Day at Camp Victory. Everyone else at Camp Victory was aware of this, except for our staff, which didn't realize it as it was our first time doing the week-long camp. And so at the end of the day, our goal is to get healthy campers, healthy and happy campers. And so we ran with it. We said, okay, well, this is camp. Camp sometimes has pie and sometimes has treats. These are good people. These are there's a certain group of ladies, and actually there's a male that's in there too, that makes the pies every week for the camp. They're local. They do a great job of it. It's created this community camaraderie for camp. And so really embracing that, we decided to use it as an opportunity for the campers to learn how to navigate some of these real life strategies. And these are just some of the campers at our camp. So some common things that we see at camp, as Dr. Carton kind of mentioned some of them. Certainly, meals are often easier meals. They're often meals that are go-to comfort foods for kids. Mac and cheese, burgers, pizza. Snacks can be quick meals, pretzels, chips, cookies. These are all things that kids love, but maybe not the healthiest things. Same thing with sugary drinks. When we first started doing our camp, it's a health and wellness camp, so we serve water and milk, and so it was sort of a culture shock to some of the cafeteria staff that we wouldn't be having, some of that flavored milk, that we wouldn't be having the soda or juice or things like that. And so certainly that's all readily available at most camps. And staying connected, I think, this is, I'm certainly going to talk about nutrition, but I think just an overall wellness appeal to camp and discussion is also important. Again, our goal is to make sure that, really to promote that positive experience to camp. So knowing that there are some not so healthy choices that are at camp, and knowing that that can happen at school, that can happen at a friend's house, at a party, really letting the camper and the parent know that there are still options, that they can still think about the My Plate when they're at camp. Think about moderation and proportions, and making sure that they're always mindful of those things, or at least, trying to be mindful of those things during camp. And I think this is a good opportunity to highlight some of that, highlight and check in on their nutrition education. So talking to the camper about, what they might eat at camp, talking to the camper about the My Plate. I think it's an opportunity to know whether or not the camper has they been exposed to that before. They should, a lot of kids are being taught this in school, and sometimes they're taught but they don't remember. It's good to have a baseline, certainly, knowledge of nutrition, and this might be a good opportunity to even refer them to a dietitian. It's opening up that segue into nutrition and into healthy eating. And I often find that sometimes the best way to talk about nutrition is to not talk about nutrition, especially with kids. Sometimes their brains kind of turn off once you start talking about, oh, it makes you healthier, but instead you have to put it into their terms. You have to, we do a lot of motivational interviewing, so I find out, what makes them, what are their inner motivations, And so sometimes it's camp. Oh, well, if we have our fruits and vegetables at camp, that means you're going to be able to jump fast or jump higher when you're on a diving board. That means you're going to be able to run faster when we do the color run. Really bringing the camp to them and bringing that idea to them to where they're at. I think that's really important. Taking it a step further is really creating those easy messages. So, hopefully there are some fruits and vegetables at camp, at least for snacks. Hopefully there are, apples, oranges, pears, things like that. So really trying to get the camper, or a salad bar even, really trying to get the camper to think about those options. Yes, there may be French fries. Yes, there may be pizza, but it's all in moderation. A slice of pizza is okay, but then try to have your fruit. Try to have, if there's a salad bar, maybe you don't like salad. Maybe they don't like salad. Maybe they put a little bit of ranch on the side and they dip some of those fresh vegetables that are already chopped up for them in that ranch. It gets it in the door. It gets the vegetables in the door. So that can sometimes help and help to think out of the box. At the end of the day, having a little less of the not so good foods and at least a little more of the healthier foods, is going to help. And I would say involving the campers, involving the parents, and really engaging them and asking them to look into the menu and look at what things will they be eating, what things will be options. Camp is meant to be fun for sure, but the goal is to take home some healthy ideas and healthy changes from camp. So, one of those should be maybe the activity that they're doing, maybe trying the foods. I think of camp as this great place that people are making food for you, right? And so all these, the vegetables and fruits are often there because they're often in the summertime, and so those are often in season. And so somebody's cut them up for you, somebody's washed them for you, and if anything, it's at least a place where you can try new things. And I really try to encourage kids to try new things, and we try to promote the 3-bite rule, at least taking 3 good bites to see if you like something. And I think that is helpful. I think engaging the campers to do that, I think, is very helpful, and it gives them some empowerment. It allows them some autonomy. That, Dr. Curtin mentioned that her kids like to sometimes go to the cafeteria because they have less supervision. They're given a chance, they're given the autonomy to pick what they want. And the same thing goes for this, but giving them, educating them and helping them navigate through some of that before camp, I think is helpful, and creating that positive message. It's okay to have a snack. It's okay to have, a treat. But making sure that we have, our healthy things in so that we can get lots of good energy and run around and do our sports well. Those are all important things to really make sure that the child and camper, knows beforehand. So sugary beverages, those are certainly all over camp. The problem with sugary beverages is that although they're very appealing to kids and their commercials and their packaging, they're really empty calories. Even fruit juice. I always feel very bad when I have a family who comes and says, well, I was drinking, lots and lots of soda, but doctor, I switched to juice, and it is 100% fruit juice. So don't worry, I'm already on top of it. And I feel the world coming down on them when I say, well, maybe let's talk about not so much juice. And we know that whole fruit has fiber. It's packaged differently, with the fiber, and so it's processed differently in the body, so you don't have those quick up and downs of glucose and insulin surges as we do when you drink fruit juice. Now, we know that the AAP, allows some fruit juice. It doesn't mean, I tell parents that it's allowed, but doesn't mean that we have to have fruit juice. I always prefer a whole orange or whole apple, et cetera. But certainly, in the younger kids, that 4 to 8 ounces is okay per day. 8 to 12 in the older kids, the adolescents and teens, is okay. But really, after that, it should be water. It should be milk. And then some of those sugary drinks have caffeine in them. And if they're drinking 3, 4, 5 a day, then that becomes its own issue. Sports drinks often come up at camp. So at our camp, we do, as I'm sure many camps do, we do a lot of activity. We do a lot of what we call moderate to, a high-intensity activity, and we couple it back-to-back with an education piece and then a lower-intensity activity, and we really do that through the day. So we always talk about, when is the appropriate time to introduce sports drinks. So sports drinks in general, if the camp has a well-rounded meal plan, if they have some of those fruits that are available at snacks especially, then they're really not needed unless the kids are out more than 1 to 2 hours with really some moderate to vigorous physical activity. And even then, water is still really the preferred avenue for hydration. And instead of using a hard, fast rule of, okay, it's been 1 hour, we all have to have our Gatorade, then really empowering, engaging the kids to use their own, their thirst. Okay, I'm thirsty now. My body's telling me that I'm thirsty. Okay, let's go for a cold glass of water. Really, that allows them to start to know some of those signals. But again, those, Gatorade or Red Bull, they have those trendy, very trendy advertising. They sound like they're scientific or maybe medical, born in the lab, furthering the science of victory. They really engage kids. And of course, then it comes back to that caffeine issue. Of course, things like Red Bull, even some other drinks that you wouldn't, necessarily think that have caffeine. Some of those, Crystal Light drink packets or similar drink packets. If you don't look carefully, then you can easily grab one that has the caffeine in it. So I often will remind parents that, to really take a look at that and make sure that they're not getting the one with caffeine, because we really don't recommend ingestion of caffeine in kids, of course. This is where the disconnecting is something that the kids don't always love hearing, but we at our camp, and I'm not sure what other camps do, but at our camp we have the kids completely disconnect. So we tell them that ahead of time that the phone either should stay home or the phone can come into the med shed and be locked up, locked with the medications and put away for the week. We encourage the former, of course. And I'll tell you that a lot of times in the beginning the kids don't necessarily like it, but we do find that by the end, most of the kids, although they miss it, they really find other ways to connect with the kids. I always say it's very quiet in the first meal all together, and then by the next meal, by even the evening time, it gets louder and louder. And by the next day, you'd look at the kids thinking that they were friends for, months or years. So they start to really connect. I think that's really special and maybe even unique now, is that kids are learning to connect in different ways. In some ways they for sure are more connected with technology because they're using virtual avenues to do school and connect with their friends. But in other ways they don't have outside influences, as many outside influences are going places, so they're almost forced to connect with their family, they're forced to connect with nature, they're forced to connect with some of their surroundings. So hopefully as we move forward with COVID, that's something that they can take from this. And I do think something that we don't always appreciate is that social media is a lot of pressure, can be a lot of pressure on kids. And so I think that after that first initial shock of I can't have my phone, that the kids might actually feel a little bit better because they're not having to think about, oh, what should I post? This person posted this, I should post something better. This picture I didn't look nice in this picture, and what have you. And so I think it does allow the kids to really unwind and unplug. And then for the parents, I think it acts as a little bit of a relief if they have the phone, knowing that the phone isn't somewhere lost in the woods or at the bottom of the pool. I think it's always helpful, especially I would think that as a parent. So I think that's really important. Homesickness is, of course, is something that probably one of the most common things that I get when people come to what we call the med shed. The true definition, or the real definition, is the acute physiological distress associated with separation from home and loved ones. And I'll tell you, this can be the less experienced camper, maybe first time at a stay-away camp, or this can be the more seasoned camper. I have a camper who happens to be the son of one of my medical assistants in one of my clinics. And as soon as he gets there, he's been coming for probably 4 years now. As soon as he gets there, Dr. Jen, can you call my mom? Did you talk to my mom today? Can you text her and see how she's doing? Did she miss me? Can you tell her to come pick me up early? He does it the whole time, and we redirect and we laugh and we play basketball. We say, okay, let's go. I think it's time to play basketball. Let's go shoot some hoops. And so we do a lot of that. And by the end, his mom will share with me on the way home that he's crying because he's sad that he left, and then he'll share all these fun times and experiences that he's had, and so we can get them through some of those uncomfortable feelings or those sad feelings, and normalize them. It's okay, and really encouraging the camper, encouraging the parent or caregiver to have those open conversations and to be positive about those open conversations and to discuss how can we work through those feelings. And sometimes it's bringing something from home. Okay, if I'm feeling sad, I always look at this picture when I'm sat at home where I have this doll that I like, that I play with. I like to draw. I like to paint pictures or write in my journal. And so I can do that when I'm feeling homesick or when I'm feeling a little bit sad. So helping them develop those coping strategies that they need, not just at camp, but as they grow into school and to get into the work setting and such. So this camp is really a unique time for kids, and I really think it's a huge area for growth and development for these kids. Sometimes it's their first time at the stay-away camps, and so that's a big deal for them. And I always remind patients, or parents, I should say, to really stay away from making those pickup arrangements. If the camper thinks that they have a backup plan, oh, it's fine, I'll just go for a day and I'll just have my mom pick me up. But then they're not being picked up. That creates a sense of desperation, and that makes it a little bit harder. And then it's also putting the camp and the camper in this funny relationship. And that can be a tough one to navigate, although most camps are fairly used to it. But preparing the camper, talking about it's okay to be sad, I think is the best way to really create that positive experience. And then also creating a timetable or a time frame for them. If it's an overnight or a weekend camp, allowing them to letting them know that it's similar to when they go to their grandparents maybe. Yeah, when we go to Grandma and Grandpa's, we go down on Friday. We have so much fun on Saturday, and then already it's time to go home on Sunday. Similar to a beach trip. If it's a week long, it takes us a day or two to get settled, but once we get settled, we have so much fun, and then we're sad to go home. So that gives them a time frame, a frame of reference, so they can kind of have an idea of what that might feel and look like, so it's not foreign to them when they get there. The camp physical. This one I obviously is very important. If you're able to use the camp specific form, I think that's helpful. As a person on the other end of camp, who's reading these forms, I think when you're completing them, oftentimes the camp-specific forms have something on them that is important for the camp, that specific camp to know. So really, whenever they're asking questions, try to be as specific as you can. We have are there any physical activity limitations to the campers' ability to participate in activity at camp, and sometimes most of the time it'll say no. Sometimes it'll say limited activity, and it's okay. Well, this is my first time meeting this camper. I don't know what that means, and so we have to delve in a little bit further. And sometimes the parent and camper are pretty on top of things, and they know what the doc meant. And sometimes it's not as clear, and so try to be as specific, as you can. The other thing is to when they're you have that spot for allergies, also including food allergies, knowing that a lot of the camps, they'll be getting some food, there'll be a food source there, so making sure that you're including those and you're including any reactions. I had a camper who had vegetables on his food allergy list, and I said, oh, okay, so which vegetables? And he said, all of them. And I said, okay. And what happens? Oh, I just don't like them. I said, okay, well, that's not really an allergy. So making sure that you're asking parents about those so that you can make that medical decision whether or not it's a true allergy or not. We definitely have some kids that come through that will, maybe it's an intolerance, maybe it's just a preference issue, but that helps to give me insight whether or not Johnny can be at the table where we're giving some sort of food, or if he has anaphylaxis and he can't be anywhere near that kind of thing. So it's very helpful to, especially, I think we don't always think about food allergies maybe in our camp applications. Including the most up-to-date medication list, I mean, that, sounds fairly straightforward, but if the visit is 9 months from then, just having a discussion with the camper's caregiver, that, it's September now, I know this is for camp, in June or the spring, so just make sure that you touch base with me if we have any other medical changes or if he has any other medication changes, so we'll need to update this list. So I think that's helpful. Of course, the AAP advises that all staff, all campers are fully immunized with their age-appropriate immunizations. You're getting often kids from definitely different areas of the state and sometimes even other states, all close together, and so it's really important that everyone is fully immunized. And then, like I alluded to, talking to the parents, if you can, talking to the parents about the form, or at least reviewing any points that you think may be a sticking point or may be questionable, or a doc may have questions about when they get the camp application. I think if you're filling it out and thinking about, okay, this person has to take care of this child, is responsible for this child for an entire week, but this is their lifeline to knowing about this child and knowing about their medical history. I think that helps you to make sure that it's specific. It helps you to make sure that the medical director on the other end or medical provider on the other end has all the information that they need. I think one thing to note, so I do weight management, so I have a particular interest in this, but it's just to make sure that if you do have a child that struggles with overweight or obesity and they're going to a camp that's fairly active, just talking to them about activity, talking to them about how that might go, talking to them about maybe red flag symptoms, because sometimes when you first start with activity, when you haven't done it for a little while, it doesn't feel so good. It doesn't feel as comfortable. And so they may not want to do it, and that may deter them from doing it. And so the goal is that they're still doing, small, gradual, but small increases in activity until they feel more comfortable. I tell them that, I'm okay with their muscles being a little sore, not as okay with joints themselves being sore, but if they're not sure, they can always reach out to the medical provider or the trainer or whoever's there on site at the camp. But I tell them that it gets better, that they are just working at their practicing, using their muscles, and they get stronger, and really changing the word exercise. I think we're a little scared, or kids kind of turn off sometimes when you say, well, you have to go for a walk to exercise. Well, most kids will relate better if you talk about play, if you talk about games, and if they happen to be active, then so be it. But I think we really do better when we talk about play, for sure. And of course, staying positive. Great, you did this for 5 minutes, fantastic. Okay, I hear that your mom is saying that you were a little bit tired, but you did it for 5 minutes, so that's good. Next time, maybe take a couple minutes break and then try to do another 5 minutes. So I think that's always helpful. So engaging the caregiver, I would say when you're talking to the caregiver about camp, really having them review what kind of camp it is and always asking what kind of camp, that helps you, I think, fill out the form, of course. But then it gives the camper and the caregiver some realistic expectations, and if they're a child who has some specific medical conditions, making sure that that mom, parent or caregiver knows what happens if Johnny gets sick or gets hurt. What's their protocol. I think that gives some comfort to the parent, of course, of knowing what would happen. I think talking to the child and the caregiver about daytime camp versus stay-away camp is always important, and really involving the camper in the decision, whether they do stay away or they do daytime, or what kind of camp options they have. I think that helps, again, to create that positive experience. Talking with other parents, asking questions before and after camp, I think talking with other parents, I think, helps to know how to prepare, looking at the checklist of the website that tells you how to prepare, how the kids can prepare. Asking questions before and after camp of the camper, I think, helps to engage the camper and helps to bring maybe some of those healthy habits and healthy behaviors home. So I think that's always that can be a positive, add to the positive experience, which is the goal. Empowering the camper, really being positive, trying new things, trying new foods, trying new activities, getting to be able to make all these new friends that they could have, be finding their best friend and they didn't even know them yet. All those things are really great things. And like you alluded to before, bring some activity for downtime. That could be for downtime. That could be if they're feeling sad. Journaling, a book, coloring. All those things are great options. And I think drinking a lot of fluids. And I think Dr. Curtin mentioned, drinking the water. So I'll often have them. I'll encourage them to bring a water bottle, so bring their own water bottle with their name on it, so they can have water next to them. They can fill the water. There's often water jugs that are around, and of course, wearing sunscreen and reapplying that sunscreen. I can't do medical talk about camp without reminding us all to really those preventative things that you would talk to parents about anyways are still so important. Swimming, also I didn't add on here, but also very important, to camper health and wellness and safety. I included a couple of resources here. I really think the American Camp Association is a really good source of information, and now being that we're in the middle of the COVID pandemic, awaiting some CDC recommendations maybe about camp, they have some really good resources that are there. And I think maybe Dr. Churchill will touch on this during her discussion, but I do think they have a lot of great resources there. The other resources here are of course, one of the AAP statements on improving the health and safety at camp, so that helps pediatricians navigate through the camp evaluation and how to help parents navigate through camp in general. And then there's that handout for parents that I think also helps them really prepare for camp and ensure that their camper is ready and that they're ready to, and everyone has a great experience overall. And just like Dr. Curtin, any questions that you have, I'd be happy to take at the end. This is just a picture of Camp Energy. We started as a weekend camp, typically 8 to 10 kids at a time, and now we're a week-long camp, and we have at least 50 kids, and sometimes a waiting list after that at a time. It's a really great experience if someone on the line hasn't done it before. It really is a rewarding and unique experience where you get to spend time with the kids and really learn about the kids in ways that you wouldn't imagine, and they teach you things as well. So it's a very rewarding, so I'd recommend it. Thank you.
Thank you. That was fantastic. I had a few slides. Do you want to take any questions for our first two presenters, Eileen, before I start? I'm happy to do that.
Sure. If anyone has any questions, you can hit #6 on your phone to unmute yourself or type in the Q&A box. Thank you.
Eileen, do you want me to just get started with questions? Because then I'm happy to have you interrupt me. I'm very flexible.
Sure. Go ahead.
Those were great. Can you advance the slides for me, Eileen? Thank you. Those are great presentations. I really want to thank Drs. Curtin and Franciscelli. I really learned a lot, and it was really great. And I guess really to try to add to that is they really covered a whole lot. I just had a few comments, and one is I think for a lot of us with COVID, as we've sort of touched on, I know I was just recently on a call here in Philadelphia, and some of the local camps are still sort of figuring out what they're going to do, and I think there's some really great, wonderful ideas about, how to plan for camp. Obviously, this year might be a little different, but in years coming as well, hopefully we'll be back to what was more of a typical norm. But I think in terms of children's social health care needs, the idea of, really speaking to other parents who I always think of as are the experts in their child's care, and even with some of my own parents of children with special health care needs, kind of talking about and thinking about some of the things they might not typically get to do. They talked about just even creating their own experiences with other parents, understanding in the face of COVID, that things might not be open, but can they, with folks in their neighborhood or parents that have, that they know through their child's school, maybe one parent could take 2 children with autism, assuming that all their infectious disease risks were cleared. I think we shared a couple of the resources already for the camp. that I think Dr. Stracciatelli presented. There was a really great link on that I often will look at, the very special camps that actually have, there's a variety of camps out there that I think were, are very specific to diagnoses. So I know, for example, there's asthma camps and, diabetes camps and epilepsy camps and children with dialysis. So there really are some great opportunities through a lot of the specialty organizations that hopefully either through medical home or through your specialist you can find those camps. And there's often opportunities. I love the picture at the end there of the opportunity to volunteer if you have time. I think those are wonderful. And just to remember that often children who have IEPs in school or even some 504 plans, they're often eligible for the extended year programs. So even if, now with school being virtual and when school's not virtual, often schools will have extended year plans where children can participate in, some extended special ed, or there's often, extended programs that, I'm hoping will still be virtual this year as well. So to be sure to talk to your child's, in your child's IEP, if you're working with families, to ensure that you have some discussion about that, to see what's available in the district. And sometimes, I know we've had children in Philadelphia where, their extended year programs could actually be used in other counties with some discussion depending on the child's needs. So just be sure to help families understand those. And often, the YMCA camps are often very friendly to children with disabilities or need accommodations, and often will allow TSS workers or therapists to accompany camp for children. So they're very inclusive. So I think that that's also a great resource for families. And you can go to the next slide, Eileen. So I just was thinking about, just some considerations, and my colleagues did such a great job kind of outlining some really great ideas and things to work on. And it just, I think COVID, has forever changed healthcare, forever changed the world. It's, fascinating to me that, we are, in a situation where we're looking at, what's on the other side and say post-COVID when we're not really sure that we'll ever really be post, right? The post kind of implies an end point. And I think that, whether children are going to be in school or camps with masks or other infectious disease considerations, I think that, with summertime, just comes a time that children need to be engaged for all the reasons that were previously stated by my esteemed colleagues. I think, other considerations are costs for support. So I think sometimes, what I've learned in my experience in sending children to specialty camps is that, sometimes you need to advocate for that child through maybe an organization. If there's something that a child needs, whether it's medication, sometimes home care nurses can do shifts at camps. We've found that for a lot of our children with very significant special health care needs, that opportunity to get to camp and interface with children with similar medical conditions that maybe, especially if it's a rare condition, I think that really can make a difference for them. They establish a peer group, and for any of us who's ever attended camp, it's great to do. And I also think it provides respite for caregivers. So just thinking about that and ensuring that we promulgate that is important. The next slide that Eileen advanced for me is a checklist that I really thought would be helpful to give to our families, as they're doing camps and interviewing for camps, and just having them do something where some things are not on websites, they just sort of, highlight a program. So I wanted to share with you just a resource to share with families or yourselves to kind of think about what you might ask, and certainly if a child has a specific medical need, asking about nursing and medication availability. And also, most of the specialty camps in my experience have both nurses and physicians on site that actually have, training in resuscitation and things if needed. And I think, I don't know if that might be my last slide, right, Eileen?
Yep, that's right.
And so I think at this point, just being cognizant of the hour, I want to just be conscious of the time. We've got 5 minutes left on the hour. I don't know if there's any questions at all for anyone.
Yep, just to remind folks, if you would like to have a question, you can do it in the Q&A box or hit #6, but I will start with some of the questions currently in the Q&A box. So one person is asking, are there oral health and nutrition policies that camps should include?
So this is Dr. Curtin. I'm not aware of any specific policies put out by AAP or the American Camping Association. Most camps develop their own internal policies, but if anyone else is aware, they certainly can comment.
Yeah, it's Dr. Horstman. I agree. I don't know that there are any camp specific outside of the general guidelines, though, of water first, of water and milk should be, primary beverages, limiting juice, limiting sports drinks, and et cetera. I do think it's very much camp dependent, especially at Camp Victory, so we have lots of different, every week there's a different camp that's there, and I know that we're all very different in how we proceed with certainly nutrition and dental oral health there, for sure.
That's great. Another question we have is, how do you deal with the helicopter parents who may be calling frequently to talk to their child, especially for the first-time camper?
So it's Dr. Horstman. I set the parents up. So if I'm the parent, so let's say I'm the pediatrician and I'm filling out a form for a parent that I know is a helicopter parent and I know that potentially is going to happen, then I talk about the homesick rules. I talk about coping mechanisms both for the camper and the parent, and I remind them that oftentimes if we're not positive, and the child feeds right off of us, so we very much have it in our power, we as the parents have it in our power to really help the camper have a positive experience. And so we engage parents at our camp. We engage parents. We tell them that we're going to post on our Facebook page, on some of our social media. We, of course, get permission. And so they can see, so they can check in with their kids virtually that way. As a medical provider at camp, I will tell them that I set it up where I'll tell them we're going to be outside, we're doing lots of outdoor activities. We may have bumps or bruises or scrapes. I won't call you for all of those. If those happen, as long as that's okay with you, I'll only call you for big emergencies or bigger things, things that I think might require care, or things that I think you might be wanting to know. That I like to set up that expectation. That way, if they have a bump or scrape, some parents say, "No, I want to know everything. I want to know everything, everything possible." And some parents are like, "Oh no, I get lots of bumps and scrapes. You just call me if they have to go to the hospital." So you definitely have both of them. But I tried in the clinic, if I know the parent is that kind of person, kind of a parenting style, then I try to set up a positive relationship and troubleshoot with them, again, developing a coping strategy for both parents and the camper.
This is Dr. Curtin. I think a lot of camps don't really, I don't think there's, a lot of camps require the kids to disconnect. I don't think there is a lot of opportunity. At the camp that I've worked at, the kids have an option to use internet in some capacity to send emails, maybe twice a week, maybe. But short of emergencies, I think it's really discouraged having the kids write letters. But I think that's some expectation that's set going in. And I think you deal with both, the parents who call all the time, and then a lot of parents use this as an opportunity for respite for themselves, to go on a trip and go on vacation and sort of disconnect themselves too.
Those are great responses. Thank you so much. There's another question. What modifications do you recommend for camps that opt to be open this year with COVID-19 modifications?
So it's Dr. Horstman. I'm not Dr. Churchill or Dr. Curtin. I don't know if you want to answer this. I don't know that we can say that. I do know that if you look at the American Camp Association, if you look at their website, they have hired a secondary company, and I can't remember the name of it, I apologize, to look through, to work with some of the guidelines and give some specific recommendations based on COVID and based on CDC, although the CDC guidelines for camp, as I understand it at least, are not out for another few weeks, but they're expected to be out in a few weeks. The ACA says that they're this secondary company that is helping them develop some of these guidelines, they will be building, the table of contents is on the website, but they'll be building a full repertoire of content to give input on this by the middle of May. I looked at the website yesterday in preparation for this. Some of what's on there already talks about some of the PPE and a number of PPE per medical provider, potential testing. I will be 100% honest. Camp Victory canceled their camps for the summertime, and I was kind of relieved. I was sad, but relieved. I think it's this is my personal opinion. I'm not speaking for the AAP or CDC, of course, but I think that there's a lot of unknown, and it's really hard to take a lot of kids that are potentially coming from a lot of different areas, put them in one place, and then quarantine them. I think, and especially if you have some of the camps with special needs camps, they're higher risk also, and so I think it's a moving target, but I think we'll know more in the next few weeks. And there are some resources. The ACA definitely has a good resource that's there for those who maybe are in a place that a state that is going to have camp. I just read that Connecticut is going to go ahead with some summer camps. And so I think that's a good resource, so stay tuned for more on that, from them at least.
That's great. We actually have some more questions, but we want to be respectful of folks' time, so we will definitely answer those questions and get back to folks. At this time, it concludes our webinar. We want to thank Dr. Curtin, Dr. Hosterman, and Dr. Turchi for their timely and informative presentation. Many thanks again to the Pennsylvania Department of Health for the funding that made this webinar possible. Thank you again.